Hello, my name's Jo Volpe. I'm CEO of Leeds Old People's Forum, a partner of Forum Central. I'm introducing this presentation on behalf of Forum Central, who co-produced the State of the Third Sector in Leeds report alongside Voluntary Action Leeds, and which is supported and sponsored by Third Sector Leeds, sometimes known as TSL. My colleague Francesca Wood is now going to take you through some of the headlines of the report, which highlights the scale and the reach of the third sector in Leeds, as well as the challenges we've experienced over the past few years, which are real cause concern. So, okay, I'm going to hand over to you, Francesca.
Thanks, Jo. So I'll now run through the State of the Sector in Leeds 2022 key findings and what it means for health and care. Next slide, please. So I want to start off by mentioning that the report was first produced using 2020 data, and this latest update analyses the data for 2022. What that means is we can see both the size and composition of the third sector, and we can also see what's changed in the meantime. It was jointly commissioned by Forum Central and VAL and sponsored by Third Sector Leeds, and the work was undertaken by Nifty Sustainability CIC. We'll start with the headline findings of what's changed, and as you can see, those changes are significant. We have a 34% drop in the paid workforce, a 25% drop in our registered volunteers, and a 10% drop in our registered organisations. And this is at a time of rising demand and more complex need, both for third sector and our statutory partners in the city. We're losing workforce and capacity, and we're losing that often from organisations working at the sharp end of health inequalities and social inequalities. And as you can see, income has been tough to secure, and income levels are not keeping pace with inflation. And that means some services and even some organisations are not sustainable. We'll look first at the size of the sector in Leeds, and the State of the Sector focuses on the registered organisations for which the data is more robust. So you can see that in total we have just over 3,000 third sector organisations here in Leeds. 1,800 of those are informal, emerging and unconstituted. So we're going to be focusing on the 1,373 registered organisations. As you can see on the right-hand side, of those 1,373 registered charities, we have 1,120 who are registered organisations contributing to the wider determinants of health. And of those, 168 are directly funded for physical and mental health care services. That number means that we're actually down 10% on the number of registered organisations from 2020. So we wanted to flag why the wider determinants of health matter and why we felt it was important to show how many third sector organisations are involved in their delivery. The NHS Confederation recently reported that up to 80% of what affects our mental and physical health comes from outside of the health system. So that's housing, finance, education, air quality and transport, amongst others. And many third sector organisations provide activities and support for both individuals and for communities that positively impact their wider determinants, particularly important when we're talking about those with the greatest health and social inequalities. And therefore, third sector organisations play a crucial role to Leeds' ambitions across the Healthy Leeds Plan, Marmot City work and tackling health inequalities. So for most of the organisations that we're looking at here in terms of the third sector, most of the reduction that we've seen between 2020 and 2022 is due to a reduction in the number of small organisations. And these often work with the most marginalised communities. There are now more micro organisations, that means organisations with an annual income under 10,000 per year, than we previously had. And there are fewer newly registered organisations, with only 10 newly registered in 2022, which is down from 82 registered in 2020. Next slide, please. So in terms of those who are directly involved in health and care or the wider determinants, we wanted to flag that those directly funded organisations include those delivering end-of-life services and mental health services, and that 81.4% of our organisations in 2022 reported that their purpose is related to the wider determinants of health, and that's up from 76% in 2020. Next slide. So now we're going to look at how the third sector is funded and resourced. And the income sources that we receive from statutory also includes the West Yorkshire Combined Authority and other government departments. The information on this slide really shows the range of inward investments secured by the third sector as well, and how we leverage local, regional and national funding from a range of funders and donors. You will see, though, that with the drop, we've actually had a significant drop from 281.2 million in 2020 to 250.3 million in 2022. And this drop may actually be masked by the influx of COVID response funding and cost of living funding that came through at that time. We did also want to note the Leeds Community Foundation funding that was provided. This is funding, but it's also development support for local organisations. And as you can see, they support a considerable range of organisations across the city. However, like many other grant funders, their funds were massively oversubscribed. You can also see that commercial activity has struggled to return to pre-pandemic levels. And the number of donors and levels of donations is often reduced as well, with many organisations reporting that local individuals who used to previously donate their time, money or goods are now coming to them for help themselves. Next slide, please. So here we are onto the number of organisations by size and their typical income. The bar chart on the left-hand side shows you the number of organisations, and that's by size, and that size is determined by the level of annual income that they report. And you can see we have a very large number of micro and small organisations, although the number of small organisations has dropped by 24% since 2020. There's also been a drastic rise in the number of organisations reporting zero income in 2022. In 2020, that was 62 organisations, and that's now increased to 127 organisations. Our researchers have calculated the typical income for each size category, and you can see these on the right-hand bar chart. The analysis of income averages really indicates the incomes have not increased in line with inflation, although typically the small and very large organisations have fared better. The sheer number of organisations is why our third sector infrastructure and the networks they support are so important to effective coordination, both within the third sector and with our city partners. As well as Forum Central, VAL and Leeds Community Foundation, this also includes the Leeds Community Anchor Network, the Neighbourhood Networks supporting older people, the Cultural Diversity Hub and the Communities of Interest Network. We also rely on larger local organisations and the role they play on supporting small organisations within their local ecosystem. So now we're going to look at the workforce, and as you can see, and as we've previously mentioned, there are significant drops across the workforce. And it's really important for colleagues and partners to understand that in the third sector, when we lose staff or volunteers, we're not just losing capacity and expertise, we're also losing trusted relationships that those staff have, often with our most vulnerable and marginalised communities. And here we're quantifying what that is in percentage terms. So you can see that we have a 34% drop in our paid staff, with staff typically moving into jobs with better pay and conditions in the private and public sectors. We also have a 25% drop in our volunteers. We know many of our older volunteers stopped volunteering during the pandemic and have struggled to return. And many others, volunteers of other ages, have told us that they can simply no longer afford to volunteer regularly due to the cost of living crisis. So staff recruitment and retention is routinely cited as a massive concern by the third sector organisations, and that's borne out by these statistics. In terms of the number of people in the third sector organisations, you can see that our smallest organisations rely heavily on their volunteers and trustees. These often include people with valuable lived experience and local embedded relationships. Our larger organisations, of course, typically have the largest number of paid staff and also volunteers as well. So we wanted to show you this information on the areas of work. This is data that's self-reported by the organisations against predefined categories, and some organisations work across multiple areas. So we don't have a lot of detail, but we thought it was useful to illustrate the areas in which organisations work. And of course, this changes year on year, but this is what they've reported for 2022. This has really obvious links to the population health groups and our Healthy Leeds plan and Marmot City work, particularly when it comes to tackling health and social inequalities. And we wanted to end by flagging some of the key implications. Our third sector organisations that our city partners rely on to deliver contracted or grant-funded services can no longer afford to subsidise shortfalls on those contracts and grants, so services are being lost. Secondly, our Leeds Health and Care Partnership partners are losing services to groups that they struggle to reach well or who need wraparound support to really drive better health outcomes and social outcomes. Thirdly, the cuts made to third sector contracts means that the demand for those services may well start to flow straight to unplanned care services or other crisis care, or hinder hospital discharge. So there's a strong risk that it will actually increase demand for costly health and care services. The fourth point we wanted to make is that this really moves us away from our Healthy Leeds plan priorities and our Marmot City ambitions, and that makes it tougher to address the root causes of need. And then for the last 2 points, we wanted to ask, in terms of connected systems thinking, please do use the state of the sector findings to inform your systems thinking. For example, we already have the Leeds One Workforce Plan for Health and Care is using this information to incorporate the third sector workforce into their work more effectively. And lastly, it's important for finance and commissioning colleagues to understand the risk of destabilising third sector services and organisations when they are making difficult cost-cutting decisions in response to their financial pressures. It's important that we don't simply shift demand to higher cost, crisis and unplanned care services and increase the health and social inequalities, which will only perpetuate and accelerate that demand and widen our health and social inequalities. We wanted to talk a little bit about what we're doing in the short and medium term in response to these findings. In the short term, Third Sector Leeds, Forum Central and VAL and others across the sector have been working closely with our statutory partners, and we continue to do that to explore ways to mitigate impacts and provide support to third sector organisations. We've also been involved through the Third Sector Partnership in developing and launching the Third Sector Strategy and the Volunteering Strategy. So these take learning from the state of the sector work so that we can work together for the continued sustainability of the third sector. And finally, we'll just end by asking you to please feel free to read the longer reports. There's links to that information and the infographic. Please do share this with colleagues and trustees within your organisation and colleagues and city partners. Thanks very much for your time.